the family members are equally important, but mother plays a backbone role in a family.
Will name my child, she's a girl child, as Yashoda, my mother. I thought that is more than sufficient for me.
Obstetric is very important care because it has two lives, and both mother is young and neonatal also.
Alone we can't do everything, but with a team we can do wonders.
For oxygenation, the heart has to be functioning because cardiac output is very crucial.
Try and see what organs we could target and what specialists we could target.
These are the cases, or most of the cases that we have been seeing since morning.
An expert panel has defined NORSE as a specific clinical presentation but not a specific diagnosis.
Pathogenic or potentially pathogenic microorganisms.
I thought good obstetricians were enough, but I realized that that's not. You need an entire ecosystem of care.
As more and more cesarean sections are being done.
I presented the data how much the perinatal, this one in NHS.
She had a dialysis also, but the family could see that after dialysis, the patient was worsening more.
Pregnancy has a dramatic maternal physiological changes. We should know this. Pregnant women are not like a normal patient.
They will require ventilation. Almost like even high frequency oscillator ventilation was also required.
We gave her Nicalia and we gave her the Lipitalol.
Posterior reversible encephalopathy syndrome, mostly because of cerebral vasospasm.
That he has to look for this, the compression of the uterus.
Also, no 120.
Vascular ligation is not an easy task.
Any chronic disorders like hypertension, diabetes,
Pre-existing disorder or pregnancy totally unrelated or coincident with pregnancy.
Of course, ECMO is a powerful technology, no doubt about it. When clotting fails, and how can we reverse catastrophic coagulopathy so that we can salvage the mother, if possible, 15 years.
Unlike the normal 5Hs and 5Ts, here we need to add few other reversible causes.
My appreciation goes to all the delegates, which includes obstetricians, neonatologists, intensivists, and all the other allied healthcare professionals.